Hi everyone, thank you for joining our webinar today. So I'm Sarah, Practice Manager, and today we're doing a webinar on MSK, and we've got Chetan with us who'll be running this webinar today. Just a bit of a heads up, if there's any technical issues, please bear with us. If you have any questions throughout, please use the Q&A button at the bottom of your screen or the chat icon as well. So without further ado, I introduce you to Chetan.
Hello, hi guys, I'm the Advanced Physiotherapy Practitioner working in Firstcare practice here in Hounslow. Right, should we get started? So today's webinar is about musculoskeletal physiotherapy. So I'm going to talk about some themes about sort of exercise and musculoskeletal, muscle and joints and nerve. Okay, so a little bit about me. So my official title is a first contact physiotherapist, and what does that mean is that people part of the Firstcare GP practice and also the wider Great West Road PCM can have direct appointments or book themselves directly for a face-to-face or an appointment with myself for musculoskeletal, muscle and joint pains. And one of the benefits of that is that all GP appointments, about 15 to 20% of GP appointments are for musculoskeletal problems. So what it does is free up GPs for other sort of more medical issues. The good thing about seeing myself, a physio, by background, is we give sort of optimal loading advice and exercise instead of the old traditional treatments, which might have been rest and painkillers. Early access to physio, early loading and advice might help reduce sort of chronic symptoms. And one thing we can do from these clinics is one of the main things we do is empower patients to self-manage their conditions. But if we need to make referrals to physio or further imaging or steroid injections or to the orthopedic departments, we can do that from this clinic. The evidence is quite clear in terms of muscle and joint pain. The main benefits, most effective treatment there is sort of exercise therapy, and this is in contrast to other treatments such as manual therapy or pain medication or even surgery. The most beneficial treatment there is in musculoskeletal pain is exercise therapy combined with a little bit of sort of psychological interventions, and I'll try and explain myself what I mean that in future slides. Okay, so how does exercise help pain? Okay, what we'll do, we'll start from the top left side and move it clockwise. So mechanotherapy. So this involves using exercise to make tissues as they sort of compress, put more tension on muscles and joints. It promotes protein synthesis, and that activates lots of cells, and that makes everything a lot stronger. So it's not just muscles which get stronger, bone gets stronger, tendons get stronger, ligaments get stronger, and cartilage all gets stronger when you do exercise. So it makes the body a lot stronger. It also increases your tissue tolerance. You can do sort of more things, which being able to do more things can make things a little bit less painful. For example, if you're spending a day in a garden and you're not used to spending your time in the garden, already having that exercise background will allow you to put those tasks and be able to do those tasks without sort of aches and pains the next day. Exercise stimulates a lot of pain relieving chemicals to be released from the brain, and it sort of trickles down the spinal cord into all parts of the body, and that's one of the main mechanisms of how exercise helps pain. Your body produces its own painkillers, which are a lot stronger than anything you can take orally. So if we can tap into this brain supply of painkillers through exercise, it can give a really strong dose of pain relief. And also at the same time, a lot of anti-inflammatory chemicals are released. So if there's any local inflammation to any joints or muscles, or if there's any systemic or body inflammation, exercise has a real positive effect. With regards to pain, all joints and muscles and tissues have their own nerve supply, and those nerves, those really micro nerves, can get quite sensitive. And one of the best things about exercise, it reduces the sensitivity of those nerves, so reducing the amount of pain signals which are sent off. benefits of exercise include resilience, that builds confidence with pain, that can get you down, and also reduce your self-efficacy, how much control you are in of pain. By building up exercise, it builds up your confidence, it builds up the resilience of your tissues. And also exercise gives off lots of happy chemicals called endorphins that sort of buzz after exercise. And the happier you're feeling with exercise or after doing exercise, the less your perception of pain is. Now, question for everyone, running and osteoarthritis. Is running bad for your knees? Now, any answers to that? Any thoughts on, is running bad for your knees? Let's see if there's any messages. It's often an old traditional thought, which considered running to be bad for your knees. Now, if we click on the next image, brilliant. This is a study, a systematic review by the authors at the bottom right, which looked at osteoarthritis of the knee in people who are non-runners, a sedentary population, competitive runners, and also recreational runners. And what it found is the highest amount of osteoarthritis to be in the non-running group and also the competitive runners, whereas the lowest levels were in the recreational runners. What do we think these sort of figures mean? That what it means is applying forces into your joints toughens your cartilage and make things stronger, reducing your chances of developing osteoarthritis. But there is a right amount. So recreational runners, what they meant was doing exercise or running 2 to 3 times a week was a nice sort of formula to do exercises. Whereas competitive runners, if you're running lots, high mileage every day and week on week, that can be a bit too much for your body, and that can lead to developing osteoarthritis or developing a thinning of your cartilage. And interesting, in the non-running group, people who aren't running, who aren't getting that stimulus of making the joints and muscles stronger, they tend to develop osteoarthritis just because your body hasn't got used to or haven't had that stimulus to make cartilage and joints stronger. So there is a healthy balance, there is a right balance with the exercise, and in regards to running 2-3 times a week is a really nice amount. And doesn't mean we all need to get into running. We can do some loading exercises, putting weight through the joints, which we'll hopefully touch upon a little bit later on this presentation, but also has been discussed by previous presentations by Dr. Anam. Doing some loading exercises over a few days, not every day, is a nice thing to do. And this is a good guidance for physical activities. And what the target is, 150 minutes of physical exercise of moderate intensity. What we mean by moderate intensity is probably where you can't say a whole sentence without needing to take another breath, really. On a rating scale of 0, easy, and 10 being really hard, what we'd probably say is about 4 or 5 out of 10 in terms of perceived exertion. You can do this, or you could do sort of 75 minutes of vigorous activities. That's when you really can't say any words, can't really say any sentences because you're working quite hard, and you're probably rating yourself as working sort of 7, 8, 9 out of 10 in terms of intensity. Key things to do with this 150 minutes is be active in some of the pictures of different exercises we've got there. Very important part is building strength. Now, the recommendations are to do 2 sessions of strength training a week, and also if you're over 65, include some balance activities. And another very important part of physical activity is to not remain in still position. Don't sit on the sofa, don't sit at the laptops for too long. Really break up those sitting times, keep moving. And really with exercise, you've got to be persistent and consistent. Start slowly, build up, and there's never too late an age to start. Really is the time is now to really start if you're not meeting those sort of 150 minutes of exercise. Next slide. Really nice slide. I won't go over it, but really nice key guides of benefits of resistance exercise to lots of body functions, lots of different conditions. Strength training can help, and a bit of guidance on the bottom right side about prescriptions of resisted training. And often one of the things with exercise, and if you're in pain, is it safe to exercise with pain? And these are some nice guidelines to guide your sort of return to exercise, really. So one thing we know, that pain doesn't mean tissue damage. Pain can be a sensitivity of the nervous system. The nerves do get sensitive in response to injury, and what it might need is some exercise to help reduce some of that sensitivity. So these are nice little key guides in terms of when it's safe to exercise. So you can exercise in a sort of, what we use is a bit of a VAS, a visual analog scale, a rating between 0, no pain, and 10, high levels of pain. And generally what we say is it's safe to exercise where there's pain during the exercise is between 0 and sort of 5 out of 10 pain. Absolutely fine. The key thing is not to let pain go above the 5 out of 10 pain. Also key is to monitor the response to exercise over the next 24 hours. So if the pain settles quickly or returns to baseline within 24 hours, it's safe to continue those exercises long terms. And the idea behind pain, exercise helping pain, that things should help improve in terms of symptoms over the 4 to 6 weeks. And that's a good little guide to see if exercise is helping your pain. And what we can do is make adjustments with making things harder or making things easier over that period to try and keep loading your activity. But also, I've talked a lot about the musculoskeletal benefits of exercise. There are a lot of benefits in terms of the body. Your body is just full of chemical reactions, and exercise is a very big inducer of lots of chemical reactions which are occurring in the body. Helps a lot of mental health, lots of other diseases which Dr. Anand mentioned a few days earlier, as well as lots of pain, promoting healing and strengthening the musculoskeletal system. Other key themes in musculoskeletal care I wanted to touch upon. Now, often patients come and see me. One of the things, understandably, they're looking for is maybe an imaging, an MRI or an X-ray to look at the joint they're having problems with. But one of the key things we found with musculoskeletal care is that often scans don't tell us what's exactly causing the problem the patients are coming to see us for. Now, this is a really nice slide and talks about people without any pain in these particular joints. These are scans on pain-free people. Now, what scans do find is there's a lot of changes in the shoulder joint, the knee joint, the back, the hip joints, which can occur, but patients can still be pain-free. So that relationship between changes on a scan and pain isn't that clear. In fact, it's a bit of a poor correlation. So what we really do is base scans on patients that need it based on clinical examination. Okay, and the other thing we often get, is this age, or am I getting older? Am I getting more musculoskeletal pain because I'm getting older? Now, I quite like these couple of graphs. So I think what we'll do, we'll start on the graph on the right side. Now, it's one of my favorite pictures I like to show patients, and it shows a 40-year-old, a sort of a cutout or a picture of a MRI or a CT scan. I'm not sure exactly which one. I think it's an MRI of someone's thigh region, and it's a thigh region of a 40-year-old triathlete at the top. You can see a lot of muscles in the thigh compared to that of a 74-year-old sedentary male. What you can see there, the second picture shows a lot of fat tissue surrounding the muscles of a sedentary person, whereas if you compare it to below, a 70-year-old triathlete, that sort of cutout of the thigh looks very similar to the 40-year-old triathlete. So exercise can negate the effects of getting older. And what people often find that when they say getting older, it's more immobility which is causing changes to musculoskeletal tissue rather than the process of getting older. So exercise really negates the process of getting older, which is more probably linked to immobility. And I quite like this graph, which looks at world record timings of different age categories, male and females, 100 meters. And what it kind of shows is the time doesn't change too much or doesn't increase too much till you're about sort of 70 or 80, and then things start to slow down quite a lot. But exercise can play a good effect in maintaining musculoskeletal health at least to 70 or 80, and then sort of other things take over when you get to an older range. But exercise can definitely negate the effects of what we regard as aging. Okay, pain is something I want to touch upon, and pain is quite complicated. It's not very straightforward, and there's two really types of pain. And first type of pain is acute pain, which example can be sort of turning your ankle. If you're out walking and you turn your ankle and there's pain, there's inflammation on the outside of your ankle, because probably you've torn or stretched some ligaments. And what we typically say on that example is through tissue healing, it'll typically take 6 weeks, maybe a couple of weeks longer, maybe 6 to 8 weeks to return to normal, and that pain fits tissue healing. But persistent pain is when you've had pain for what we describe as having for more than 3 months. This is where pain gets a bit complicated, and it's not necessarily linked with tissue problems or tissue damage, and lots of different factors can be related to having persistent pain. Now, these are some different factors. I've stolen this slide from my old work, but it's a very relevant thing. Sort of lifestyle factors can have a big effect on the perception of pain. If you're sleeping or diet is not quite optimal, those are things which can have an effect. I know definitely that sometimes my knee's a little bit sore, and if I haven't slept well, I feel my knee pain a little bit more. Physical aspects, of course, the conditioning, keeping strong, exercising, maintaining your physical health, and if that's not sort of up to optimal levels, then that can make tissues weaker and might mean we're not exercising as regular. When we have pain, that can get us down. Okay, that's the fourth one, is psychological. If we go back, just go back a slide. Yeah, we'll go to the social one. The social ones, and if we're in pain, we might be avoiding some of the things that we enjoy, such as visiting our friends and family. And if we're not able to do that because we're in pain, that can exacerbate pain. But other social factors is we're not coming back from a sort of culture of doing regular exercise. We're not used to doing regular exercise. That can be a reason why pain persists a little bit longer. But also things such as work. If we've got a very physical work, I know a lot of the local population work at the airport, so might be doing a lot of physical work, and if we're not quite conditioned to do that physical work, that can put a little bit of strain on our bodies. But also with airport work, there's a lot of shift work, and there might not be time to exercise, so they can all play a part in sort of persistent pain. Psychological factors, one thing we do know, if we feel a little bit low, that can sort of heighten our pain perception. So if we've got an injury and we feel quite low, that can exacerbate it. But also one thing we're learning is thoughts and beliefs about pain can have a big factor in pain perception. So, for example, one thing with back pain, and we'll touch upon back pain a little bit later on, that lots of thoughts and lots of myths and lots of mixed messages out there in society in terms of, oh, let's not bend forward if you've got back pain. And then if you've been told a lot not to bend forward or not to pick up any heavy weights, and then it's a fact of life, you're going to have to pick up things from the floor, such as a basket of washing. You've just unloaded the washing machine and you have to pick up that. And if you're going to pick up the washing basket and you've already got a fear of bending forward, that can exacerbate the pain. There's other factors as well. The bottom row, such as pathoanatomical, yes, structure can play a part, as we touched upon earlier, but it's not the be all and end all. So that's changes in tissues, genetics, what you're born with, the genes you've got. There's not too many things we can do in regards to that. And the neurophysiological, we touched upon that, about nerves being sensitive. Now, when nerves get sensitive, your body can take a long time to sort of reduce that sensitivity through exercise, but it can happen through sort of exercise, reducing the sensitivity of the nerves, but it does take a long time. Next slide. And these are some of the myths that I've got from our Charter Society of Physiotherapy website. A few myths out there. This is specifically in regards to back pain, but I suppose it can be generalized to other body pain. One myth, which hopefully we don't do anymore with musculoskeletal pain, is rest is the cure. The best thing you can do with MSK or musculoskeletal pain is optimal loading, keep moving. That's very important. Let's go down the list. Because it's my spine, that it must be something nasty and serious. One thing we know with back pain, if people are having back pain, less than 0.5% of back pain is due to any sort of nasty or sinister. A very, very small proportion of people with back pain have anything nasty or sinister. That's one thing that's been found consistent. And a lot of back pain is linked to those 7 factors that we spoke about earlier. And a lot of treatment with regards to back pain, that is, if we can target it towards those 7 factors listed on the previous slide, such as physical, lifestyle, psychological, social factors, as well as reducing the sensitivity of the nerves, basing our treatments and trying to target all those different factors are the best thing we've got to target lower back pain. A scan will show exactly what is wrong. We touched upon that from a previous slide. The scan often doesn't show us exactly what's wrong. So reason being, because of all those 7 factors listed on the previous slide, that's the key thing that can sort of drive pain as opposed to just the tissues. I should avoid exercise, especially weight training. We've touched upon that. Exercise is a very safe thing to do. In fact, we need to encourage that to promote our MSK health. Moving will make our back pain worse. Hopefully we've dispelled that myth. And one sort of last but not least, pain equals damage. Now, hopefully we've touched upon it based on the previous couple of slides, but pain does not equal damage, and especially important in persistent pain. Pain is very real, but pain can often be a sort of a false alarm. Your nerves get very sensitive, and it's a bit of a warning system for your body, but that warning system can get quite faulty. You can fire messages such as pain when your body's not necessarily experiencing any tissue damage. Oh, perfect. Another very key component of musculoskeletal pain, especially in your lower limbs, such as your knees and your hips. Research has found that if you are overweight, so overweight is suggestive of BMI over 25, if you lose 10% of your body weight, your symptoms or your functions will improve by 50%. So that's a massive multiplier effect. So a really good target if you are overweight, i.e. BMI of over 25, if you target yourself to lose 10% of your body weight, and if you're experiencing knee or hip or ankle pain, your symptoms are likely to improve by 50% if you lose 10% of your body weight. So that's a real important part of musculoskeletal health. And we've talked a lot about physical health, but physical health is just a small part of a healthy lifestyle, and a lot of these 4 factors, they're linked together. Diet is very important in the growth and repair of tissues. Physical health, very important aspect of mental health. Having good mental health helps you sleep better. So all these factors are linked together. I'll just touch upon them very, very slightly. Physical health, we've talked about the recommended amount of physical exercise. Diet, very important to have a nice balanced diet, and a lot of NHS resources. If you look at NHS sort of guidelines and diet, good balanced diet is promoted, and there can be good help resources on the NHS website. Mental health, very important. A lot of stress going on at the moment with all things going on at the moment. Very important to look after your mental health, and things such as mindfulness, meditation, yoga, very important things to relax your mind and reduce any body tension you might have. And I know that Dr. Deer touched upon mindfulness in the earlier webinar. And sleep, really. Sleep's very important in the growth and repair of your tissues, help you relax, and having good sleep hygiene is very important. And again, the NHS website is a good resource for tips on how to sleep better. So all these factors really come in together, and you can't really separate them, and a lot of these factors put together can help musculoskeletal symptoms quite significantly. Now, these are a few sort of further reading. They're not really reading the videos there, and it's a little bit more fun. These are really good links and resources to review, really, if you're interested in musculoskeletal and joint health. The first one talks about exercise, and which is interestingly titled, "What is the single best thing you can do for your health? Exercise." I won't give it away, but really good link, really short video. I think it's less than 10 minutes. The second one is by a physiotherapy professor in Australia, a really funny guy, really nice funny video, talks about why things hurt, and very good explanation on pain. And the last thing, especially, I think a lot of people, probably the main thing I see in my clinics is back pain. A really good resource, the final one, which talks about what back pain is, a bit of education about back pain, and the multifaceted factors involved in back pain, and some of the things we've touched upon earlier on the webinar. So really good resources to read on if you're interested in some of the things that we've spoken about today.
Thank you, Chetan. That was a really informative webinar. But if anyone does have any questions, please do email us, give us a call. We will have many more webinars in the future. So thank you again, Chetan. Thank you for everyone who attended. Bye.
No worries. Take care, guys.